In this section, we'll talk about the Fraser Guidelines. So, Fraser Guidelines is simply assessing competency around contraceptive use, or having the capacity to consent to such things. So there's 5 things that need to be met for anybody who's under the age of 16, because anybody 16 or over is assumed to have capacity. The 5 things are: understand the professional's advice, meaning in this case, say in this case, if you're a medical applicant, you obviously can be the professional doctor here. So it's going to be the doctor who, when they give their advice to the patient, whatever their advice is regarding the use of contraceptives, any safety netting, or explaining to them to the risks and stuff, that they understand. Second one is they can't be persuaded to tell their parents. The third one is it's in their best interests that they don't get parental consent. So for example, they might have parents who might, there might be a risk of harm, physical harm, mental harm, some sort of abuse if their parents find out. Without contraceptives, their physical or mental health will suffer. And finally, they're likely to carry on with what they intend, regardless of whether, so if they're intending to have sex with somebody, they intend on carrying out with or without the contraceptives. So all 5 conditions have to be met to assume that they have capacity in this regard. So let's just talk through these things. So firstly, get an understanding of the situation, because most likely they'll want contraceptives for sex. However, contraceptives can be used for other purposes, like acne or managing period pain. Then, obviously, depending on what they say, you explore that particular topic. But in this case, your medical interviews is usually around sex, because there's a lot of legalities that you need to be aware of regarding these things, because it's a potentially very risky situation. So the first thing is in terms of if they're saying I want contraceptives because of sex. So let's say it's someone under 16, maybe a 14-year-old girl, and she says, I have a new boyfriend that I'm thinking of having sex with, so I'd like some contraceptives. So ask her, do you understand? Do you understand what sex is? And there's a risk in the fact that it carries risks. So STIs, pregnancy, even emotional and physical trauma, potentially. So does she understand these particular risks? Because obviously if she doesn't understand this, then she doesn't know what she's getting herself into. Then that means she obviously doesn't have capacity in this situation. Then ask that regarding the contraceptives themselves, does she understand how they work? So there's many different types of contraceptives. And of course you'd assess it depending on what specifically she's asking for, if she even knows what specifically she wants. So there's a combined oral contraceptive pill. There's a progesterone only pill. So combined pill is basically, it has estrogen and progesterone. The POP just means progesterone only pill, so it only has progesterone or progesterone. And then there's injections, implants, and there's IUD, IUS. So it just means intrauterine device, intrauterine system. Intrauterine device is simply a small device that is implanted into the uterus, which releases copper, which is toxic to sperm. Intrauterine system is the same, the device is the same shape, it's like a T shape, that again goes into the uterus, but this one is hormonal because it releases progesterone or progestogen. So does she understand these contraceptive options are available to her, and does she understand the pros and cons? Because some of these medications, like the combined pill, they can increase the risk of clots. You know, things like a stroke, for example. So clots could be DVT, which means a clot in one of the veins, stroke. And then there's contraindications as well. So in certain circumstances you can't have it. For example, if someone's being treated for like breast cancer, so if you're receiving chemotherapy, that's a contraindication to any of these hormonal options. The only non-hormonal in this case would be the IUD, because it releases copper. Everything else releases either progesterone or estrogen. Then get an understanding of the situation of, you know, this, if they're wanting to be intimate with someone, because this is potentially a safeguarding issue. So who is this person? Obviously you want to be have some tact in how you ask. You don't want them to feel like they're being interrogated, especially if this is a abusive or exploitative situation. Then you want to be delicate with the situation, because they might hide information out of fear. So who is this person? How did you meet? How old are they? And they can ask about other things like alcohol and drugs. So if you're going to be intimate with this person, are they, you know, are they trying to involve you with anything else like alcohol or drugs, or just anything else that might be suspicious? Like, are they asking you to go on some trip with them, you know, go to another country without telling the parents? Are they wanting to do something with you that they're specifically not wanting you to tell anyone? Because that will obviously raise suspicions. So this is pretty much it. It's just a summary of the Fraser Guidelines, and you know, these 5 things have to be fulfilled, and then get an understanding of what it is that what is the patient's understanding of the situation? Do they know the pros and cons of whatever decision they're wanting to make? And obviously, if they don't have an understanding, then you need to refer in this case. So the easiest thing now would be, we'll just discuss the different age categories, and then we can talk about when you would refer. So 16 or above, they're assumed to have capacity. And 16 is the legal age to consent for sex. Between the ages of 13 to 15, so this is a grey area. If both parties, so let's say it's two people in a relationship, if both parties are between 13 to 15, then discuss with safeguarding. So discuss the situation, you need to assess it. Assess the situation to see if there's any risks to either of them. Is one, abusing the other? Is there some kind of exploitative relationship? Is anything else going on, like alcohol and drugs? Things like that. So based on the potential harms that may occur, this will then determine whether the safeguarding will then refer to the children's social care, which is a group of people who they deal with these, potentially harmful situations. So they support the patients, but also the families and anyone who's involved in the situation. Under 13. So under 13, it doesn't matter how much capacity they seem to have. Anybody under the age of 13 legally cannot consent for sex, regardless. So if someone, so if one is 16 or above plus so anybody who's 16 or over, if they're having sexual relationships with anybody who's between the ages of 13 and 15, this is completely illegal. And obviously anyone who's having sex with anyone who's under the age of 13, this is again illegal. So that's pretty much it. I hope that was helpful. Please like and subscribe. More videos will be coming soon. Thank you. And if you have any questions or you need me to clarify anything, then please just leave a comment in the comment section.